I am the Dean. My name is Dr. Mary Umar Kamara. I am the Dean for the Faculty of Nursing and Allied Health. I'm also one of the proprietors for the university. This is the Skills Lab. But before I get to the Skills Lab, I want to talk about the program itself real briefly, okay? This is a bachelor's program, which means when the students complete the program, they will be awarded a BSc in nursing. It's a 4-year program, 8 semesters. This is a very, very strong program that is based on international standards. My background makes me uniquely qualified to run such a program. I hold a bachelor's of nursing, master's of nursing, and a doctorate in nursing practice. I practice in the US as a registered nurse working on the floor. I work as a clinician, which is diagnosing and treating patients. And then for 12 years, I was a full-time assistant professor of nursing in a BSc program. And I literally imported that program here, which means our program will meet any international standards. For a strong program like nursing, requires a very strong skills lab because nurses are the ones who are in contact with patients 24/7. To take care of those patients, they should be prepared in such things like health assessment, all the skills. And in order for that to be possible, you have to have the resources. And what I'm going to do now is show you the resources that we have in this lab. As you can see already, you see we have patients here. Why? These are called mannequins because they can die and then they can come back. A human being doesn't. What it is, the students will practice here. They make mistakes and we correct them so that they don't make mistakes when they go to the real world. Because like I said, these patients, we can kill them and then they can come back. So we have these patients and it's like a simulation. We have checklists and you can see our books over there. Every skill, every nursing skill that the students are supposed to learn, they're in there from start to finish. The students follow those guidelines, which are standards, to provide care. For instance, if they want to do wound care, they just don't come here. They follow the steps there, from washing their hands, telling the patients what they're going to do, and following all the proper steps to prevent infection. And they practice that way. And at the end of the semester, each student has to demonstrate competency in all the skills. That's what we do. So we have our patients here. You can see these ones, okay? This is how they practice to do the IV, to put an IV and run IV fluids. You can see stethoscope. We have a blood pressure cuff as well. So they can learn how to do vital signs. It's not only by mouth. They really do learn to do all these things. And we have Chromebooks here. Our students use this to take exams, but now we are going to actually start using this during the skills lab so that once the teacher is demonstrating, they will be following with the skills instead of using the books. We used to use books, so now they can use the computers to follow the skills steps that they're supposed to learn. And so that's why we have Chromebooks here, one Chromebook per 2 students. We have more, we just displayed this ones. Okay.